Okay, so good afternoon, everyone. This is our fourth annual Mental Health and Addictions in Construction webinar. While COVID has dominated the headlines over the last several years, a second headline that has emerged and been called the silent pandemic is issues related to mental health and addictions. And so while mental health addiction stats can be difficult to capture, specifically, I think it's well known that it's underreported in men. The bottom line is there's a lot of people that are suffering, and there's a lot of men, especially in construction, that are suffering, and they're suffering in silence. And so today's webinar, you're going to hear from leading experts on the services that are available throughout Ontario. This includes Minister Tibollo. This is his file, and he's shown tremendous leadership over the last 4 years. But you're also going to hear from people that run benefit plans, from the CPO and other mental health providers, including the IHSA. We also have two presenters that have experienced mental health issues themselves, and we're going to end the webinar with them speaking about their experience and offering their thoughts on the issue. So today is about getting two simple messages out. The first is, it's okay to not be okay. Coming out of the COVID pandemic, we've had more people that are not okay more than ever. And then the second message, and this is the really critical one, if you aren't okay, you need to ask for help. That's your job. You've got to do it, and we need you to do it. And if you're not okay, that's fine, but you got to ask for help, because there are a lot of resources out there. There's a lot of people that want to help you, but you got to speak up, and you got to ask for it. I would like to thank everyone who played an organizing role in today's events, including all the speakers and the presenters, the RESCON Health and Safety Committee, as well as Amina and Ahid, who, as we all know by now, are the ones that do the real work when it comes to putting these webinars on. I'd like to do a quick land acknowledgement as well, and then I'm going to turn it over to Amina to introduce our first speaker. So I would just like to respectfully acknowledge that we're situated on the traditional territories and treaty lands. In particular are those of the Mississauga and the New Credit First Nation, as well as the Anishinaabe, the Williams Treaty First Nations, the Huron-Wendat, and the Métis Nations. As RESCON's office is located in Vaughan, we are grateful to have the opportunity to live and work in this territory. With that, I'll turn it over to Amina.
Thanks, Andrew. Our keynote speaker today is Michael Tibollo, the Minister of Mental Health and Addictions. Minister Tibollo proudly serves the people of Ontario as the province's very first Associate Minister of Mental Health and Addictions, and has made his mission to create a connected system of care with comprehensive wraparound services so that every Ontarian can be fully supported in their journey towards mental wellness. Prior to taking office, Minister Tibollo volunteered as a certified addictions counselor and advocated for a bed-based therapeutic community in the city of Vaughan, seeking to support those struggling with mental health and addiction challenges. Minister Tibollo holds several Canadian Addictions Counselors Certification Federation certifications, including the Canadian Certified Addiction Counselor, Canadian Certified Recovery Coach, Canadian Indigenous Addiction Counselor, and the Canadian Certified Telemedicine Addiction Counseling Professional. Welcome, Minister Tibollo, and thank you for being with us today.
Thank you, Amina, and thank you all for inviting me once again to this really important seminar, the opportunity to speak. I know that the Residential Construction Council of Ontario takes mental health very seriously, and I'm very appreciative of the opportunity to come back now for the fourth time and talk about mental health and addictions and the impact that it has on our society. The leadership that you've shown in supporting the work that I do and supporting all the people that are part of the construction industry is an incredibly important role that you play. And I know that you're making a difference, and we're making a difference in the lives of so many people by continuing to talk and to do things around mental health. Mental health and addictions are issues that are very close and personal to me. I have a connection to them because of the work that I did in the past, as was mentioned. And prior to taking office, the time that I spent in the bed-based residential therapeutic community, I became certified in the field because of the interest that I had and the desire to want to do more. During this time, I worked on the front lines. I helped a lot of people that were struggling with their mental health and their substance use. I had the privilege to then become the minister responsible for mental health and addictions, a journey that started as me being the Solicitor General, and of course being exposed to the PTSD, the moral injury, and the other difficulties, the trauma that our first responders and frontline workers face each and every day. And from there, I became Minister of Tourism, Culture, and Sport, and I got the opportunity to learn a lot about sports and the importance of sports in building resiliency in our youth. And then, of course, I guess, I don't know how, but I worked really hard and lobbied to make sure that there was a voice at the table when it came to mental health and addictions. You know, a lot of people don't realize, but 1 out of every 3 people will experience a mental health or an addiction issue in their lifetime. Things like mood disorder, schizophrenia together are the second most common reason Ontarians are admitted to hospitals, next only to giving birth to a child. Mental health and addictions challenges are issues that can be felt throughout the province, in every community, in every workplace. It's one of the reasons why, when we developed the Roadmap to Wellness, we wanted to ensure that we looked at the lifespan of individuals, the type of services that should be delivered to each and every phase within that lifespan, looked at step care, and then the delivery of culturally sensitive services, because it makes a difference if you are Indigenous, or if you're Francophone, or if you're Black, or South Asian, or as I like to say, police officers, because they are a subset within our communities that require special attention and care. And we've seen, all of us, just how difficult the situation has been as a result of COVID-19. We had a pandemic on our hands, as was mentioned, relating to mental health long before COVID-19 hit. And you can only imagine how much more complicated and difficult the situations have become. It's impacted on everyone, every facet of the family, every individual, one way or another, from the children to the families, to the adults, to workplace. And we know that research and the data continues to show that everyone in the province has increased anxiety and depression. And we've seen a surge in addictions and the damaging results, including a notable increase in opioid-related deaths, which is something that has been extremely troubling to me. Our government takes these mental health and addictions challenges very seriously. I mean, I'm the first minister appointed to the role of mental health and addictions, or responsible for that. You know, we invested during the pandemic $194 million in emergency funding for mental health and addiction services, over and above the commitment to invest $525 million in annualized investments to ensure that we have the appropriate supports where and when they're needed anywhere in the province. And recognizing the impact of the pandemic on people with substance use disorder, we also established just recently, February of 2022, the Addictions Recovery Fund. Now, that $90 million is an investment that will support hundreds of new treatment beds, helping to stabilize and provide care for about 7,000 clients per year. That sounds like a lot, but we know we still haven't done enough. Investments in other, we've done other things to help along that as I mentioned, the lifespan. We've invested in other addiction services, our youth wellness hubs that some of you may know about, mobile mental health clinics, something that would help in remote and rural communities, the police partnered mobile crisis intervention teams, and additional community supports that provide life-saving, stabilizing interventions and treatment options. Our government is continuing to work to build on the Roadmap to Wellness, and that's our plan to build a world-class mental health and addiction system that addresses Ontarians' diverse needs through safe, evidence-based care. And since 2019, our government has invested more than $500 million in net new annualized funding, which is attempting to address the gaps in care, enhancing supports, and creating new and innovative services for mental health and addictions. The province has also continued to invest in programs and services on the substance use care continuum. And this includes the Ontario Harm Reduction Program enhancement funded through 34 public health units, consumption and treatment services, community-based harm reduction outreach, as well as the provision of harm reduction supplies to prevent disease transmission, and naloxone to prevent opioid overdose. Ontario is dealing with a crisis of opioid overdoses and deaths. You all know that. We hear about it in the papers, if not every day, every other day. And over the last couple of years, thousands of people have died from opioid-related causes. Of these victims who were employed, approximately 30% in the construction industry have lost their lives. And that's something that has impacted the industry incredibly. Just to put that in perspective, if we lost, and the number is approximately 3,000 people last year, and 30% of them are construction workers, that's 900 skilled labor, people that are desperately needed if our economy is going to go forward, that have lost their lives. Not only have we lost that individual's skills, but we've also lost a father, we've lost a brother, a son, and this is something that we just can't accept as a society, as a community, and certainly as a government. What we've done is we've tried to work and amend, in the case of construction, the Occupational Health and Safety Act to have the requirement for employers to provide naloxone kits in the workplace. If there's a risk to a worker, we want to ensure that there's the opportunity to save that worker's life. The amendments also include requirements related to training and maintaining the naloxone kit. The Ministry of Labor, Immigration, Training, and Skill Development is currently working to ensure that naloxone kits and associated training are available to workplaces before the new requirements come into force. This is just one more step that we're trying to put in place to do whatever we can to save lives and help reduce the stigma around opioid use and addiction. Addictions and mental health is clearly one of the most pressing health issues of our time. People living with addiction or mental health challenges have often been stigmatized, but it's encouraging that we continue to see important progress in this regard. It's fantastic that we're here today talking about mental health and addictions. Again, talking about it helps remove that stigma, because it is okay to not be okay. Not everyone has the best day every day. And recognizing that and accepting that is the first step to us fixing problems and providing the supports and services that are necessary to ensure that no one goes down that road by themselves. It's a difficult journey, but we all, in one way or another, have aspects of our lives that bring us to the point that we are depressed or that we are anxious. It's a question of learning the tools and knowing that there are resources out there to help you. And Ontario, I believe, has come a long way over the last few years in building a strong foundation to create a connected and integrated mental health and addiction system for the province and for the people of the province, so that individuals can get the support where and when they need it. Now, some of you may say, yes, that's a great, it's a soundbite, but what's really happening? And you know, when I became minister, I used to think to myself, how am I ever going to build a system that's going to give the same level of care everywhere in the province of Ontario, so that people have those supports and services as close to home as possible? But we're making that effort. We're working towards creating that. We are committed to continuing to work and to take real action and make the investments that are necessary to ensure that every Ontarian will get reliable access to high quality mental health and addictions treatment and recovery-oriented care. I'm going to say that again, recovery-oriented care. My concern, as is the concern of the province, is that there is sufficient treatment capacity to ensure that when an individual asks for help, they get that help where and when they need it. We speak about abstinence, we speak about functionality. The most important thing to do is to ensure that when someone asks for help, they get it. And that's why the commitment was made to build a treatment continuum, to invest in withdrawal management, in treatment options, bed-based treatment, but also outpatient day programs, and ensuring that all those pieces are there. And then, of course, the most important part of all is to address these social determinants of health that impact everyone one way or another, whether it's education, whether it's food security, but most importantly, housing, which is, again, one of the reasons why I'm adamant about ensuring that the construction sector is healthy, both physically and mentally. We need now more than ever the support of all construction workers in the province of Ontario. And the only way they're going to be able to do their jobs and do them well is to have mental health, because that will give them the physical health they need to be resilient, resistant, be able to go home and enjoy their families each and every day, but also committed to building the province and making the province a better place for all of us. So again, if there's time for questions, I'm more than happy to take them. I want to thank RESCON again for the opportunity to speak to all of you. I will always make myself available to you because you really are the backbone of the province of Ontario. Without construction, without the work that you all do collectively, the province would be in very dire straits. And I certainly recognize and support anything you do to keep the people of the province of Ontario housed, the people of the in the construction industry doing work each and every day, healthy, mentally and physically. So thank you, and we'll keep working together to make sure that we build a strong, solid future for all the people of the province. And we support you in the work you do to advocate and bring forward the mental health and wellness in your workplaces and all workplaces in the province of Ontario. So thank you very much.
Thank you, Minister Tibollo, for your remarks. This is the Minister's fourth time speaking at our event, and he has been a key partner to us since we started holding our annual symposiums in 2019. Thank you again for joining us. I really liked what you were saying at the end about how the workforce needs to be mentally well so we can be physically well. I think we often associate mental health and wellness within our individual selves, but it obviously has implications beyond just ourselves if we're not mentally and physically well. Our next speaker is Dr. Joel Moody, who is the Chief Prevention Officer for the Ministry of Labor, Immigration, Training, and Skills Development. Joel joins the ministry from the Electrical Safety Authority, where he held the role of Chief Public Safety Officer and Senior Director of Analytics. He's a seasoned public health and occupational health and safety leader with over 17 years of experience working in various labor organizations throughout the province. He has championed innovative approaches to harm reduction and regulatory oversight and made equity, diversity, and inclusion central to his leadership philosophy. Welcome, Joel, and thanks for being with us today.
Well, Amina, thank you so much, and to the other members of RESCON and to our audience. Thank you so much for inviting me back again. This is my second year to just provide some thoughts for the group to think about as we talk about this very, very important topic of mental health. And Minister Tibollo, thank you so much for your remarks. Here at the Ministry of Labor, Immigration, Training, and Skills Development, we work very closely with your ministry, and Minister McNaughton, has definitely been very well briefed on this topic as well. And the opportunities to demonstrate, as you say, when we talk about the wellness of workers, the wellness of employees, it's not solely the physical aspects, but it's the mental aspects as well. So thank you very much for making those remarks. You touched on an item as well about opioid poisonings that are unfortunately continuing to happen within the province. And as you said, we've recently amended the Occupational Health and Safety Act to make preparations such that if employers know or ought to have known that there's increased risk of their staff using and potentially having an opioid poisoning, that we want to make naloxone kits available for them. And so we're in the process of working through those final regulatory pieces and looking at maybe a temporary program to help the employers and businesses become compliant. So more to come. Minister McNaughton will be able to make some announcements very shortly. But why is it important? You mentioned, the 3,000 deaths that had happened in 2020, and that was about a 15% increase from the prior year. And we do know that since the COVID pandemic that has been with us, the rate of emergency department visits for opioid poisoning have increased by 57%. And these are the aspects that are happening within all of our communities. And so rural communities, people who experiencing issues of poverty, homelessness, BIPOC individuals, those risk factors are part of our society, but they're also part of our workforce. And so how can we look and be aware of what are the factors that are associated with those that are in the construction industry, those that help keep the economy of Ontario moving, and those that also help keep Ontario open for business. so very important that we are working together in order to maintain the health and safety of all. And that's one reason why, we talk about mental health in the workplace. It's so important. So as you know, in 2019, we had tons of extensive consultations in our occupational health and safety system that ultimately culminated with the identification of mental health as a serious concern for the workplaces. Evidence, data, personal stories, all of those things coming together that related and ultimately lended their ways to the new prevention strategy called Prevention Works that started in 2021, which has identified that mental health, violence or harassment even in the workplace are central themes that we want to target and that we want to improve over time. So at the ministry, we've developed a work-related mental health plan, and it really has 3 objectives. So the first one is how do we, to Minister Tibollo's construct, how do we improve coordination of the system? And so, not just systems in occupational health and safety, but across systems that influence work-related mental health and addictions. How do we build the best evidence to determine for those interventions that we are using, are they effective? Are they truly making a difference? So how can we use that at a system level, at an employer level, at an individual level? And how does that then lead to future programming initiatives? And then the last one, helping employers, small businesses, independent contractors, all of those aspects to really understand how do you create a psychologically healthy and safe workplace, such that including the prevention of violence and harassment. So all of those types of things, by working with our partners, I see some of our colleagues here at the IHSA, but our other stakeholders like yourselves, RESCON, how do we bring awareness to these issues? And how do we then continue to destigmatize the impact that, an opioid poisoning, a substance misuse, mental health concerns within our individuals and our population, such that at the end, we're creating programs that not only talk about treatment, but prevention, identifying early, providing the safeguards and necessary programs that actually help individuals manage and have that resiliency. And I would be remiss if I didn't talk about the work that has happened all through this COVID period. So as you know, the respiratory season is still upon us around respiratory illness and disease. And we know that the impact that this pandemic has had on mental health. So continue to do everything that we can to help prevent workers from getting sick. You've heard the Chief Medical Officer of Health talk about ensuring that you get your vaccines, you wear masking as appropriately, and if you're not well, avoid exposure to others. So it's so important that we continue to do all those things that are important to help keep economies moving, Ontario open, and that we look for safety as well. So I want to say thank you very much. You have an incredible lineup of individuals that will be speaking with us later today as well. And it's been my honor, Minister Tibollo, to speak after yourselves. And definitely it's a priority of ours here at MLITSD to ensure that we're working with your ministry to continue to raise awareness and bring attention, and to also help find solutions to the mental health challenges that we face within the province. So thank you so much, RESCON, and thank you for having me here today.
Thank you, Dr. Joel Moody, for being with us. We're always happy to have you here. And your point of how do we get there, or what do we do to increase awareness, is the perfect segue to the next 2 speakers that we have. We will be highlighting a lot about what employers can be doing, and also what are the resources that employees should be taking advantage of. So firstly, we have Kathy Martin from the IHSA. Kathy is the IHSA's Workplace Mental Health and Wellness Specialist, working with the research stakeholder and public relations team. She brings a wealth of experience spanning over 25 years in the field of workplace mental health and addictions, consulting with countless organizations across Canada. Kathy was part of the technical committee with Canadian Standards Association, building the first ever standard for psychological health and safety over a decade ago, and later the co-chair of the psychological health and safety standard for paramedic organizations. She currently remains actively involved with these standards, as well as currently leading a system-wide OHS project for the Ministry of Labor Prevention Office, targeted at reducing opioid-related harms in the workplace. Kathy, we're happy to have you with us.
Thank you. Yeah, no, those were great speakers. Thank you, Minister, and thank you, Minister Joel Moody as well, or Dr. Joel Moody. IHSA, as you know, has been in the industry of health and safety for many, many years. And I'm really pleased to say that IHSA is now taking up the torch when it comes to mental health. And they hired me about 1.5 years ago. So we have been busy working hard to develop some sector-specific services and products. And we have a great strategic plan. And so today I'm just going to give you just a really quick high level of what we do have available to date and sort of the direction of where we're going. So things that you can look forward to and ways you can get involved with IHSA in providing your feedback and your insights as what the sector needs as well. So I will share my screen, if that's okay. Oh, you'll all see my puppy there. So as I said, you know, IHSA has been doing a lot of great work in the safety realm for many, many years. And
we can't see it if you're sharing.
Oh, sorry. Thank you for letting me know.
Well, let me know if I did something on my end. There it is.
No, Andrew, I forgot to just click share.
No worries, no worries. Okay,
that was just my bad. My bad. Yeah, so as I was saying, IHSA has definitely been involved in health and safety for many years, but hasn't, you know, it has been a little slow to come to the table, I will admit, in addressing some of the mental health issues. And I think there's been many reasons why. I think construction, as you all know, working in this industry, is a highly regulated industry. There's so much to do when it comes to safety. And I think now more than ever, there's that strong connection. And Joel, Dr. Moody, you were talking about the data. The data has been driving this conversation for a while, and we know we need to do something in this space. So IHSA, as I said, is jumping on board, and I'm just from the prevention work strategy, IHSA wanted to make sure we were aligning with our prevention work strategy, and we also have built off of that strategy. And so now IHSA has workplace mental health as well as part of our strategy, as you'll see there in that little number 2 box. And from that, what we decided we needed to do was take a moment and pause and do a real good deep environmental scan and get a lay of the land on what's happening in the space and construction, but not just construction, and the other industries that IHSA serves, so transportation and utilities as well. So we spent some time in 2021 building off of the prevention work strategy and looking at what IHSA could do in that space. And IHSA set the goal, which I think is a pretty good aspirational goal. It's you know, to create psychologically healthy and safe workplaces and mentally healthy workers throughout IHSA sectors. Sounds simple enough, but as you know, it's complex. So what does when we talk about psychologically safe and healthy workplaces, I think it's just always really important to just remind everyone that there's a couple things happening here. One is the promotion of psychological well-being of our workers. We talk a lot about our workers needing to be healthy and well, both mentally and physically. And in order for that to happen, we also need to provide psychologically safe workplaces and safe work practices and all this other stuff that kind of goes along with supporting that psychological well-being. And that's what we talk about when we talk about that psychological health and safety is actively working to prevent harm to employees' psychological health due to these negligent, reckless, or intentional acts. And one great way to think of that is if you think of violence and harassment in the workplace, if we're not addressing that, that's taking sort of that negligent, reckless kind of act. If we're not addressing it, we need to make sure we're addressing those things that have known risks. So psychological health and safety is around the risk prevention. I'm sure most of you know that, but for those who may be on the call, that's a little not as clear. And then of course, the core principle, obviously behind all of this too, is similar to physical safety, is we need to have that prerequisite. We need to have a psychologically safe and healthy work environment to be able to ensure that people will be well. So it's that prerequisite to the promotion of health. I believe you can do both, but you do need to be at least doing the safety piece. And of course, I won't go into all this too much, but today, I'm hoping to, use this as an opportunity also to engage in a conversation with folks that are also on the call as to what you might need and prioritizing some tools and some gaps. So one thing I'll just always remind people, when we're talking about these issues, they are kind of complex in the workplace, and it's the best to not take a whack-a-mole approach. My VPD done at IHSA always told me that from the get-go when I came in was, help people learn to look at the big picture and how to integrate this into the occupational health and safety management systems that you already have in your workplaces. So that's been my goal, and I've been developing some tools to help you with that. Again, I've been developing some tools that are looking at these 4 main buckets. There's certainly the psychological health and safety management piece, trying to teach organizations on what that's all about. Also looking at the workplace culture and what are the things that we need to be focusing in on to support a psychologically safe and supportive work culture. And then the third piece being the employee wellness and supports. And of course, IHSA, because we're fairly new in this space, looking at organizational and structure needs and what does the system need, the construction system need to be successful, and what are the partnerships that we need to be driving to develop. So a partnership with RESCON is a great example, working together to support. So we've been developing lots of different things. We have some guidance documents that's been developed, some webinars, on-demand webinars. We have a series of 8 podcasts. We've developed some safety talks, and there's been a couple magazine articles. And we have also been going around and speaking at many of our different labor management network committee and giving presentations. And really, the presentations have been focused on that call to action. So I just want to, again, just quickly let you know some of the things we're doing. The participants on this call, you'll get access to these slides, which will be linked. But we do have a new presence on our IHSA website around workplace mental health, and we've developed 5 toolkits. One is for employers on looking at that strategic approach, how to look at psychological health and safety and worker wellness and all of that combined into a strategy. And then we also have a worker toolkit, and that's designed for you to give out to your staff and to your folks on the boots on the ground. This is just get that into their hands, and it really will just talk a little bit about where they can get access to resources if they're looking for some support. And then the supporter toolkit is for managers, supervisors, frontline folks who might be concerned about someone in their workplace. So it could be colleague to colleague and not sure, how do I engage in this conversation? What do I say? How do I support someone? That toolkit was developed with that conversation in mind. And we've been talking today about the opioid crisis in the trades. And that's something that IHSA is starting to take more effort. And I'll talk about that a little bit more, but there is a couple of things for that. There is the opioid crisis in the trades toolkit, which has 19 objectives for workplaces to start looking at in developing a strategy to start targeting some of the upstream prevention strategies, which as well as some of the support strategies that are needed to support workers who may be experiencing a substance use disorder. And then of course, some workplace violence and harassment information as well. We've developed an online e-learning, which is very short. It's only a 20-minute module, but it's one of those things that it really sets sort of the base understanding of workplace mental health and what that all means, and talks a little bit also about the psychological health and safety piece. Worth checking out if you haven't had a chance. It may be something you want to consider as an add-on to maybe internal training that you already have, or as a standalone. And what's coming up in 2023 is IHSA has just completed an RFP competition for developing some manager and supervisor mental health training and addictions training. So stay tuned. We're going to be working with someone from the mental health community in developing this training. So it won't be just IHSA developing it. This will be in partnership with mental health organization. And it will be trades specific. So it will have that trades lens, and it'll have the voice of those from the trade community who've experienced mental health or addiction issues. And we'll also be having some worker mental health training as well come out of that. So that hopefully will be done long before the end of 2023. So stay tuned. We're excited about that. But I think what's really needed right now is some tools and information around how workplaces can address the opioid issues in the workplace. So we've got a couple things on the way. There's some new guidance documents that should hopefully be out in the new year, relatively soon. And we're looking at a short document on just understanding some of the risks of opioid-related harms and the value of having naloxone kits in your workplace. And then we're also looking at a much larger document with some companion training for employers, again, on looking upstream and looking at some of these prevention strategies when it comes to preventing some of the harms related to opioid use, and just understanding the complex issues surrounding why we have this problem in construction, and looking at the different key drivers behind that. Again, with partnership with the Chief Prevention Office, IHSA has been asked to take a lead on a 3-year project in supporting the construction industry around addressing opioid issues. So lots will be coming forward. So if you hear the stats and you worry, how am I going to tackle this? Just know that there are people rallying around and developing tools and resources. I know the ministry's team around the naloxone legislation is developing some program and tools and resources, and IHSA is working in collaboration in making sure that we have some construction specific resources for you to draw on. Yeah. I won't go on too much further because we have a packed agenda, but we are going to be also with IHSA recognizing that the knowledge that I hold and others hold in this space need to get transferred over to our IHSA consultants who are actually out there on the field working with the different companies, yourselves included. So we'll be working this year on skilling up internally as well and driving that. So in the meantime, I'd be the main contact if you do have any questions. My contact will be, well, it's right there, but you'll also receive that in your package. But there will be one ask I do have after this session when you do receive the package. If you do feel you need more supports or you want consulting or training options, if there's anything on your mind that you think IHSA might be in a position to support you, just to let us know what that is. And one of the ways you can do that is through this little mini survey, which you will have a QR code come to you. And that's it. So just a quick high level of some of the things we're doing, but I definitely say check out the IHSA website. There's lots of different things. There's a couple opioid podcasts, and there's an opioid toolbox talk, and yeah, call to action. There's lots of different things.
Perfect. Thank you very much, Kathy, for being with us. It's great to learn about all the resources out there for employers, especially how to approach mental health and understand mental health in construction and what the reasons are of why we have this issue. So thank you very much. Next, we have Matthew Porter. Matthew is the Senior Director of Client and Business Development with Benefit Plan Administration Limited, known as BPA. Before joining BPA in 2017, Matthew worked with a large national insurance carrier holding various roles in group retirement, group benefits, and individual insurance. In his position at BPA, Matthew identifies, develops, and implements new products and services to support clients and their members, including mental health and substance abuse programs for LIUNA Local 183, ensuring that these matters are given due prominence. He's received the Fellow Life Management Institute designation from LOMA and the Certified Employee Benefit Specialist from the International Foundation of Employee Benefits Plans. Thank you, Matthew, for being with us, and we're looking forward to your presentation.
Thank you. Thanks for the opportunity to present the LIUNA mental health products and the addiction products that are available to all members. I'm going to share my screen right now and go through some slides that will demonstrate or show the offerings to members and what they can access. So just bear with me and I'll pull it up. Sorry.
It looks good. We can see it.
But you can see it. So we always try to work off some key objectives at LIUNA and what we call LIUNA Care. So the mental health offering, we refer to it as mHealth. And here's the 6 main bullet points that we try to address. So we want to end the stigma of mental health, right? Both personal and public. Encourage members and their families to seek assistance for mental health well-being. Number 3 is very important for us to remove barriers to mental health treatment, regardless of social, cultural, economic, or geographic factors. Enhance the accessibility and quality of mental health, and then also provide integrated mental health care to coverage to ensure coordination of care. And then lastly, of course, very important to everyone, enable for full productivity of members, both at home and at work within their communities. So those are our key objectives at LIUNA when addressing mental health. Members can always access all benefits through the members' website. At the top of the website, they would have an access to an mHealth link that will take them into the mental health resources. So once they get into the mental health website and the resources, immediately they'll have access to start the program. So click on Get Started, and that will take them into a dashboard of different resources to use. So you can go from an assessment tool to the actual access in the mental health virtual digital program, other member resources, information, and then lastly, more information about their in-person mental health benefits. Right in front of you is an example of the resources. So various podcasts, articles, videos for members that they can watch, review, get updated on different types of mental health treatments. And then they can go and check out mental health benefits, what's available to them. Outside of the digital program and other programs I'll get into, all members at LIUNA Local 183 do have access to $1,000 per year in face-to-face mental health counseling. And then they can also go into and do their self-assessment test. So walk through, takes about 5 minutes, some questions, some videos they can watch, and will help them with the assessment. From there, it will give them a report. This report can be given to their physician or a counselor for more information. Once you go through your interim report, you do have the opportunity to immediately start your digital intake program for mental health. And that's where you'll take you. And from there, members can access the digital health program. Okay. So what is mHealth? mHealth is the 12-week cognitive behavioral therapy program, a 12-week CBT. Okay, it's 24/7. That's what we like about it, right? Members can do it anytime, weekends, it's always available. Access to case management, reporting, assessment for physicians, and it's continued monitoring too. That's very important. Members will always be monitored and followed up, even months, weeks after the program is finished. And there's no limit on sessions. So while it is a 12-week program, if members want to re-enroll into the mental health program, they're able to do that and receive further treatment. We've talked a lot about, the health substance abuse, addiction treatment is very closely related to mental health. So there's various programs available to members through LIUNA. The first program is a digital offering too as well, and we do this to end the stigma around mental health. It is a 24/7 access, 365 days a year, and we call it SMART, so substance management and recovery treatment. And it will give them access to an addiction specialist, counselor, and you'll get same thing, testing, self-tracking tools, check-ins with the coach, and if required, access to a registered addiction counselor. Okay. And then from there, there's also the inpatient program. We're really happy about this. We introduced this at the start of 2022. So all members have access to an inpatient program through Edgewood Health Networks, EHN, 7 locations across Canada, including in Toronto. And it's a 7-week program. Members can just show up if they have to, or call, and they'll actually have someone send a car and pick up the individual for the in-treatment program at the residential facility, Edgewood. All costs are covered by LIUNA, so there was no out-of-pocket payment from the member for anything within the program. We also have a specific outpatient or opioid outpatient program in partnership with Canadian Addiction Treatment Centers. This program is specifically designed for laborers. Members have access or priority access, extended hours, and resources that are, like I said, very specific to the laborers and to LIUNA. And then we also have our intensive outpatient program, also through Edgewood Health Networks. And these are for individuals that perhaps they're not ready for an inpatient program. It's the same facility. We call it an IOP, so intensive outpatient. Members will visit the facility for several hours per week to receive counseling, but it will help those who perhaps are not ready for full inpatient programs. There's also the virtual care. So we talk about coordination of care. There's also an effect on other areas from, could be from medical prescriptions to nutrition, diet, exercise. Members can access all of that information, receive support for that through vCare virtual care program that they all have access to as well. And then lastly, all members have access to healthcare navigation. So if a member's ever in doubt of what to do, where to go, there's a lot of programs available to members. They simply can contact the healthcare navigator and they'll walk them through what programs are available for them and what is best service or treatment for them at that time. And then just lastly, Local 183, this is a top priority for them. They've spent, since 2019, considerable amount of time to try and build out and grow the programs for members. They've demonstrated over the last year with the inpatient and the intensive outpatient programs. There is money. They are working very hard. These programs are being utilized by members, in particular too. While we are talking about members, spouses, dependents do have access to the digital programs through LIUNA. Okay. And that's a quick kind of run through of the programs. I don't know if there's any questions.
Yeah, we do have a couple questions, and if anyone has more questions, we can ask those as well. So the first question got sent to me. So the first question that came in was, can you use your own therapist, or is it 183 provided therapists, or how does that work? Like if you had a therapist you're comfortable with, is that covered, or do you have to do an assessment and get a 183 approved therapist, or I guess how does that work is the question?
No, they can use any therapist they want, anyone that they're comfortable with. Also, if you go into an inpatient program or the intensive outpatient program, those people are specific through the facility. For one-on-one counseling, the members can access anyone that they're comfortable with and that they prefer.
Excellent. And then the second question, I know you touched on it, but it is a big one, just with respect to privacy. So let's say you're a worker on site, is there any way for, your site super to know, or somebody in HR to know? Or is there any way for the board of directors or the trustee to know? How does the privacy really work?
Yeah, so no data is shared with employers, with the union. We don't even know the data ourselves. We just know high level data. For instance, how many members are accessing the program, what the instances are of those. But from that, we don't know any details of the individual's accessing treatment. And we take that very important. We know that's an important part of mental health and substance abuse is the confidentiality of it. So that's treated in the highest regard at Lina.
Yeah, and then another question is, so is this open just to members of 183, or is it also open to members of their family?
So the digital programs I went through, so I talked about the mHealth program, so the digital mental health program, the digital substance management program, so SMART. Those are available to members, spouses, and dependents. So all eligible family members do have access to those programs. The inpatient program and the intensive outpatient programs are members only at this time.
Okay, so those ones, but I mean, the access to a therapist and stuff, that's for.
And access to a therapist is part of the benefit program. That's for family members too as well.
Excellent. Okay, so I will give everybody a couple more seconds, but I think those were the main themes of the questions. So we'll give everybody a couple seconds. If there's no other questions, I just wanted to say thank you to you, but I want to say thank you to BPA and the whole 183 benefit fund. I do sit as a trustee on the fund right now, and it's well, I think everybody knows that fund is one of the best funds in the construction industry, but I think across Canada, and certainly BPA and Matthew have done a lot of work to make sure that the resources are there and available to members. And maybe you want to speak on this, Matthew, but I think this fund was really one of the first ones to have mental health as part of it, right? And I don't know if you want to, there is one more question, but I don't know if you want to speak to that, and then we'll ask you the last question.
Okay. Sorry, Andrew, do you want me to answer? I just saw the question come up on the screen there.
Yeah, so I'll ask that question, and then you kind of have, so what the question for everyone is, construction has injuries. Does Luna Care have a specific mental assistance for coping? And I guess this is really kind of the psychological, I guess, aspects that maybe go with a physical injury. I think it's probably what they're trying to get at, but I'll certainly let you answer that.
No, members can access the mental health programs or mHealth, right? That will, help them access mental health treatment for any type of injuries to support them through recovery. We heavily utilize that program on behalf of the disability management program at Lina. So that's really closely integrated into the disability management services that we offer.
Perfect. And then, I mean, I kind of asked, I guess, what was the history? I think, this plan was one of the first to have it. I don't know, as a final thought. Yeah. Yeah,
we started in 2019. It was one of the first programs. It was a really high priority from Local 183. They wanted to make sure that this was addressed. So we're really happy we got it in before COVID, so great timing. So it was rolled out, members had access to it all throughout the pandemic. And then from there, we built it out on it through the substance management programs. That can be challenging to develop and to implement. But since then, I feel we have a very well-rounded program. We will try to make different venues or avenues for access, from digital to in-person, inpatient, outpatient. So trying to give members choices of how they want to access treatment on how they feel best about it.
It's fantastic. So just last time, I guess, thank you very much for speaking to us today, and please take a big thank you back to everybody at BPA as well. Thank you very much.
Thank you, Andrew.
Okay, so I gotta move some stuff around. This next section, it started as a conversation, and so a theme that's come up is asking for help. And so one of the people that are going to speak is a gentleman named Bryan Zoran, and I'll introduce him properly. But he went through a mental health crisis, and he wrote a blog on it. And so we'll be sharing that blog or column as part of the recap to this event. But one of the themes in that the blog was the idea that Bryan felt it was okay for other people to need help. It was okay for other people to feel weak. It wasn't okay for himself. He felt a little bit of shame or guilt that he couldn't be stronger. The other speaker, and I'll introduce him as well, kind of shared these thoughts. And so one of the themes that we wanted to address is, why is it okay for other people to need help? Why is it okay for other people to have a mental health issue? And why is it not okay, you know, for an individual to say, it's okay for me to not be okay? And so I think hopefully I've introduced that, but the idea of this conversation was to get at that topic. So it's okay for you to not be okay. It's okay to ask for help. We need to treat ourselves as nicely as we treat other people. And so we did have to pre-record this due to scheduling conflicts, but there is a conversation featuring Bryan Zoran, and he's the Associate Director of Education at the IFEBP. So that's the International Foundation of Employee Benefit Plans. This is a not-for-profit association that provides education resources essentially to labor and management trustees that jointly administer health and wellness, you know, training funds, pension funds, and other people in that space. This group, you know, is a leading body when it comes to conferences and education programs. And Bryan, I've known him for about 9 years now. He is our Canadian contact. And so he is intimately involved with all of the Canadian conferences. The other speaker, I think he's North American renowned. He's certainly someone that we've gotten to know, and we're very lucky to have him participate. So his name is Big Daddy Tazz, and he is a mental health advocate. He has a big personality. He is a great person. And after 30 years of denying that he had a mental illness that was controlling his life, Big Daddy Tazz realized that being manic depressive, attention deficit, socially anxious, and dyslexic could either destroy him or enhance his life. You'll see the choice that he made. And now Big Daddy Tazz tours the country speaking on good mental health, bullying, and customer service. For the last 14 years, Big Daddy Tazz has brought forth light and laughter for those living with mental illness by raising awareness that the stigma affects all of us. His newest endeavor, Stand Up Against the Stigma, Tazz believes that it's time to educate, embrace, and empower everyone so that we can all stand tall and give stigma a bad name. So I am going to share my screen now. I'm going to skip ahead on the agenda to Amina's part, and I'm going to try and do this really quick one more time. Can you jump in for me, Amina, on the next one?
Yeah, this is the last session, so.
Yeah, but even if you can do the closing, then we can lead out with it and get it to work.
Perfect. So thanks everyone for joining us today at our 4th annual Addressing Mental Health and Addictions in Construction. While we started our mental health and addictions efforts in 2018, much of the conversation in construction and really in the general public was about awareness building, about coming to the realization that yes, we understand that people in our industry, many of us are dealing with mental illness and drug use issues daily. And I think as an industry, we've come a long way on this part. As we saw today, there's considerable resources that are being developed every year and updated every year. And I think we have really good partners with the government. However, the stigma is still strong in the industry, and it is preventing people from asking for help for themselves. For example, when we're telling young kids or new people to join the construction industry, or when they do get their first position, and we're telling them on how to succeed and get their foot in the door, they're often told to keep your head down, do what you're told, and check your emotions at the door, or leave your emotions at the door. And unfortunately, comments like these may have the unintended effect of people not asking for help once they get on the job site or once they start their job in the office in the construction industry. And so those comments like that, or the comments, I guess you have to be tough to work in construction when we're recruiting young people, are counterproductive to also trying to reduce the stigma. And through our work on this issue and diversity, equity, and inclusion efforts, RESCON is going to be working with key partners to better understand how we can further change the culture of construction so that it is less macho and more open to emotions rather than just the emotions of happy and mad, which I think we all know, if I'm being frank, are ever too common in the construction industry. And so with that, I'll see if Andrew has some time.
I've got it.
Okay.
Sorry, I can do this one. I've got it. I think whatever Amina did there did the trick. So let me know if this works. Hello, everyone. So in this session of the webinar, what we're going to do is we're going to have a conversation about mental health. I'd like to welcome Bryan Zoran from the IF, and I'd like to welcome Big Daddy Tazz, who is a mental health advocate. We're just going to have a conversation, the four of us here. We're going to start with Bryan telling a little bit about his story, and at some point, you know, Big Daddy Tazz is going to tell a little bit about his story, but it's going to ebb and flow, and we're just really going to have a conversation about mental health. So with that, I'm just going to turn it over to you, Bryan.
Thank you, Andrew. Yeah, I'm Bryan Zoran, Director of Educational Programs Canada for the International Foundation. And over the years, I've really been an advocate for mental health education. We have a lot of health and welfare education and health and wellness innovations conference where we often feature mental health sessions and also webcasts that address suicide prevention. And our bigger conferences, it's part of the agenda, and it's really been, you know, part of my journey in the last 10 years in this position to advocate for more mental health education. And in fact, we started holding a mental health conference in 2020, a virtual one, and we've done it 3 years now. It's in every August and September, but you know, it was very personal for me over the last year. It actually started in July and August of 2021. I had a mild depressive episode that probably lasted 6 weeks, and it took me about 5 weeks to get a counselor. I was calling the EAP, they were giving me recommendations, and I was calling, nobody was calling me back. The EAP would listen to my problems, and that was helpful, but I couldn't actually get a counselor until I was almost feeling better. So I got through that and was doing pretty well. And then this past December, January, I went into this major mental health crisis that pretty much lasted through July. And, you know, I guess to back up, I mean, over the past 20 years, I've had, you know, episodes of OCD and depressive disorder, but I would call them mild. And I would call this thing I went through, this last episode was major. And so, you know, and I wrote a blog about it. I was inpatient for 5 days in a hospital, and then subsequently I was 6 weeks in partial hospitalization. But in any case, you know, when you're going through it, it's so much different than when you're advocating for others. You know, I think we talk about stigma, and first of all, we have to remove it when we think about others, but it's very hard to do it when you're the one experiencing it. And it's that empathy that I could feel, you know, for others who are struggling, but I couldn't find the empathy really for myself. I really blame myself for a lot of it. And you know, you get down in that hole, and it's you don't feel like you're going to improve. But I knew that I'd recovered before, so I thought, well, you know, I can recover. But at the time, when you're in the middle of it, it doesn't feel like you're going to. You know, I was very open. I asked for help. You know, I was telling my friends and family, counselors, and I got really frustrated because they always said, you know, it is true. You have to talk about it, and you have to, and that helps heal it. But that wasn't even seeming to help. Journaling, counseling, mindfulness, you know, it just felt like even the resources I was given were like, you know, I would have to try to move mountains to have the energy to use them. And I think, you know, even those hospitalizations, while I was going through them, I thought, oh, this isn't helping, you know, why am I even bothering with this? But now I look back on it, and I needed those things. It was a cumulative effect that finally I found the right counselor. I think was, all those months of work. I mean, I give the credit to my counselor. She gives it back to me because she said I did the work. It's, a struggle when you're going through that. But I will say, now that I'm on the other side, I am living a much better life than I was before I went through it. My priorities are totally different now. What I value in life is really the important things, and I would obsess about things that really just honestly weren't important or were minorly important. And I think, that's kind of the big lesson I've learned through all of this. And there is a great author, James Clear, who wrote a book called Atomic Habits that really helped me, because everything we do is a habit, and we can either have positive or negative habits. And I don't want to go too far off here. I got a lot more to say, but I'd like to let Big Daddy Tazz comment, or Andrew or Mina.
Yeah, no. Thanks for kind of kicking it off and sharing your story. And maybe, yeah, we'll go to Big Daddy Tazz, and then we'll just, chat and ask questions of everybody. So.
Bryan, listening to your story, it's something that I've experienced myself many times through, and I was making some notes while you talked, because otherwise I'll forget, because that's the way my brain works. My head, like an Etch-a-Sketch, right? I get a thought and shake it, it's gone, right? But when you said it was, you reached out to your EAP and you were so upset with yourself, and you didn't want, you didn't feel like it was gonna help. And I've been there as well. It's like having a sore throat. We talked about this earlier. It's like having a sore throat, and then every few minutes you swallow, and your throat is still sore, right? And it feels like it's never ending. It's like trying to sleep at night, where you're like, I'm never gonna get to sleep, and I gotta be up at this. It feels so daunting and so heavy and so unmanageable. But the hardest thing that we can do is ask for help. And you did that, right? You asked for help. And people, we've been, especially males, right? Like we were saying, males are born with this magic wand between our legs that make us impervious to all kinds of pain and sorrow. And we have to be, the steadfast for everybody. And we don't have these emotions. We can't have these emotions in public. Boys don't cry, men don't cry, right? That sort of thing. And, how many times we heard be a man, grow a pair, or anything like that, such toxic things to say when we're hurting, we're hurting, and we don't know where to turn, and we're afraid that people are going to judge us, and we're not going to be that rock. Well, I was in Halifax a while ago, just before the storm hit a few months ago. And I'm looking out the window, and we were blessed with this big, I was doing my keynote, and we were blessed with this great big window in our suite. And there was a rock there, and it was probably as big as my house, if not bigger, right? It's on the harbor. And there's this rock, and I thought, that's what I got to be, because, for the last couple of years, I've been trying everything I can to get out of my funk, and it's up and down and up and down, and it becomes so draining at some point in time. And I forget, because to take care of myself, because if other people are phoning me and I'm trying to help them, and keep doing my keynotes and keep writing my blogs and keep, that sort of thing. But I looked out and I went, that's what I got to be. I got to be that rock. That's exactly what it was. And then as I'm writing and getting ready for my presentation, within a little while, that tide came in. And then I looked, the rock was half, and then the rock was a quarter, and then a rock was there. And then finally the rock, and I watched as the last bit of the rock, which was immense. It was a massive rock. The water came in and just capped it off. You couldn't see the rock anymore. And that's when I realized I don't want to teach men to be rocks. I want to teach them to be what I need to be, which is the buoy that's attached to the rock that floats with the tides in and out, to teach people that it's not important to be the rock, but you can be there for them and yourself. And Bryan, how did you feel when all of a sudden you were the one that had to take, time off? How did you feel about that in your brain about yourself?
Yeah, I felt like I was a failure. I felt like there was something wrong with me, and I had great support. I mean, we talk about workplace supports. I mean, my supervisors, and I mentioned in my blog about having a work rock, and he said to me, I said, I gotta go to this conference because it's so important, and to work. And he's like, you know, because I said, it's a very important program. He said, you're a very important program. And that kind of made me go, wow, well, yeah. And, you know, and the whole time I felt guilty. Well, this conference was going on in June. Like I even tried to talk my supervisor into going, like letting me go there, but they said, you know, you're not there yet, go get better, and then come and work. And it was huge just having them say that to me. And, you know, really, I could tell they meant it, but, you know, giving employees the time to go get better. And then when they come back, you know, I feel like I'm, you know, replenished, and I was actually able to deal with it. If they would have let me come back when I wanted to, I don't know that I would have kind of went over that hurdle. I needed that time to actually work through what I needed to work through.
And it's odd that we never see ourselves through the eyes of those that love and care for us, right? We always think that we're a failure. You know how many times I've been, you know, I will never take my life, but I still get suicidal on I don't want to say on a regular basis, but I still find, you know, why am I here? Why am I brushing my teeth? I'm just going to have to do it tomorrow. I'm going to have to blame. I'm a piece of garbage. I can't, you know, I'm a fraud. I'm not a good father. I'm not a good ex-husband, over and over. And then you start going down that hole, and then you forget how to love ourselves. And that's what it is. It really comes down to loving ourselves. You know, you told me today that you had, you know, you had experienced this. And my first thing I said to you was, why didn't you call, brother? I would have flown out I would have come and found you, whatever, because we're so able to help other people, but we won't help ourselves, right?
It's just an odd human nature thing, right? I mean,
Exactly.
we internalize it all like somehow it's our fault, and
Yes. We break our leg, where do we go? We go to the hospital, right? We chip our tooth, we go to the dentist. We have a broken heart, somehow that's our fault.
Yeah.
Right? I don't think anybody that's watching this has ever thought, oh, you know what? I've got the flu. Well, this is my fault. I'm such an idiot for having the flu. What's going on? You know, somebody gets cancer. You don't go, why would you have cancer? You know, you have a heart attack. You're just doing that for attention. You go into anaphylactic shock. Nobody blames anybody for that. But somehow when we have a mental illness, if we called it a brain disease, people would be like, that guy's got a brain disease. We need to have a fundraiser for him, or she's got a brain disease. Well, we call it mental illness, and the word mental in there makes it's in our head. Do you know how many times I heard that? It's in your head. Yes, it's in my head. Right?
And then it affects your whole body, right?
It does. It affects
your whole body.
And then the one thing that you said is, how long did it take you to find a counselor?
Yeah, the first time when I went through my not my major depressive order, it took me almost 5 weeks. And so, you know, those days I'm just like struggling. I needed to talk to someone, and it's like, you know, the days would go by and it just get worse and worse. And eventually I was, you know, I did mindfulness. I had been doing that prior to, but I was actually starting to come up and feel better before I actually even connected with a counselor the first time. But when I went through the major depressive thing, I wasn't coming out of there until like July, and that started in like December, January. So, but you said a few things that just I wanted to comment on, and that's, you know, how we talk to ourselves. We tell ourselves stories about ourselves, and a lot of times these are the same stories we keep telling ourselves, and they're usually not supportive. And we need to change that narrative and start telling ourselves positive things, because that's the other thing I learned going through this is so many times in life, the first thing that would come into my mind is, you know, I'd think about something, oh, you can't do that. I'd like, before I even thought about it, that was the first thought, a negative. And now I have a different viewpoint. I'm like, well, maybe I could do it, maybe I couldn't, but like, why was my default to a negative narrative about myself? We have to be our best friends, or, you know, we're gonna have troubles.
We would never talk to our best friends, nor our worst enemies the way we talk about ourselves. You know, the brain that runs our whole body, it should be like, hey, good job, you get it today, that's fire, they get out of bed, let's go, hey, woohoo, let's go, and away we go, and here's all positive, good try. but it doesn't. We'll do something good, and we're like, hey, I feel good about myself. And your brain will be like, yeah, but remember in grade 2 when you farted and pooped your pants in front of everybody? Do you remember that? And you remember that person said that, and that person said that, and it feeds that gremlin that lives in us, right? Because anxiety and depression, anxiety is a thief, and it steals our ability to see that everything's going to be okay. Anxiety will steal our happiness away and make us feel this, and depression is a liar, and depression will lie and say, you're always going to be like this, and it's because you deserve this, and you are not very good. Don't bother trying to get out of it because you're never going to get out. It's all junk. Right? It's all because of what we've learned in the past and what we have to relearn. And for those the people that don't know what mindfulness is, it's just being in the moment, right? Exactly. It's not living in the past. You know, I have done many things in the past I can't talk about because I'm embarrassed about, and also I don't know what the statute of limitation is on some stuff, but I don't live there. I don't live there. But when you get depressed, it's almost like, oh, let's flip back a few pages. This is where, remember, you did this, and you did this, and you did this, and you did this. Our brain sort of goes back there. So mindfulness teaches us to be in the moment and recognize, yes, I'm having tears because I'm scared. I'm having anxiety. This is not true. Yeah. It doesn't mean it's not happening. It means it's not true, right? And I read a...
So to jump in on the mindfulness, because I think that's huge. So we've got, you know, people in construction that can accept that mental health is real. They can even encourage their colleagues to go and get help. And you guys both touched on it. When it comes to them, no, I don't want to ask for help. I don't want to admit that I'm weak. I'll just tough it out. I'll be stronger. And so I think part of today is saying, like, if you think you might need help, you know, there is no downside to asking for help, right? And I don't know if you guys have some thoughts related to that, or can talk about what you think or feel about that. But like, we're really trying as a theme today is like, nothing bad's gonna happen if you ask for help. Something bad might happen if you don't, but like, it's a zero risk activity, right? But I'll turn it over to you guys to discuss.
Well, yeah, I'd like to take that first, if I may. I think it's important to ask for help when you need it, but what amazed me, I was really concerned about what my colleagues thought and what they knew, because I started to feel better and I was ready to go back to work. And there was something in my head that was like, well, what do they know? Some of them might know some stuff. Some maybe were told some stuff. And I wrote that blog, and I'll tell you, like, I just shared it with the world. And after I did that, it was so freeing that, like, the question was gone then. What do they know? Well, now everyone knows, and yeah, big deal. So what? And it's okay to ask for help, and it's okay to suffer and admit that sometimes you're struggling. And, but the fact that it was so freeing is what surprised me. It just was like, it was, really just, it changed my whole perspective on things, because it just opened things up for me. And you're not surprised, Big Daddy Tazz, but the people that reached out to me, colleagues, former colleagues, friends, family members that read my blog and said how it influenced them. I mean, it was so humbling. I mean, it was just amazing for me.
Freeing. That's the biggest word there. It's freeing. We often worry too much about what other people think of us. And my gran used to go, you're not supposed to know what other people are thinking of you. Right? And it doesn't matter, really. Does me having depressed make me less of a boxer or any less strong? Or does it make me less of a comedian or a father? Does it make you less of a contractor? No, it doesn't do any of those things. It makes you human. And so you're right. People don't get help because they're so afraid what other people will think. And we often worry about what people think who shouldn't matter in our lives at all, right? But once again, it's because we treat it as if it's something that we can help, and it's not. And we need to. And I'm not a politician-y kind of person, even in my stand-up or anything. But when we vote in people, whether it be locally with our union or with federally, we need to bring people in that understand the necessity for timely access to mental health and addictions, and universal pharmacare. And when we have an EAP, like you said, you reach out to your EAP. Some of them are great and some of them are terrible. My best friend, her EAP said, "We'll go and deal with it and call us back in 14 days." And she goes, "I'm not going to be alive in 14 days."
Right.
Right?
So my EP was good, but the references that the local people that were the counselors had no availability, and they were so behind on it that they didn't even return calls. I was like, this is madness here. So I mean, and I think that's a common theme across the U.S. and Canada.
Yes.
Is people need help when they need it, not 6 months later, not 6 weeks later, not 6 days later. They need help when they need it. So that's the important part about reaching out. And I think it's frustrating for folks that do have a problem, and then they reach out and no one's there. So that's when you need to reach out to family and friends or people that who have experienced it and that would be on your side. But I put in my blog, it takes a village to help get someone through a mental health crisis, and it does. And you need to lean on everyone, and don't be afraid to.
And that's okay, right? I mean, it's just like, if I remember one of my first jobs was with a mason, and I had to carry bricks up, and I was carrying bricks up the ladder, and I was a strong kid, 15 years old, bringing these bricks up and bringing this this mortar up to and bringing it, and finally after like a week or so, and I was so sore, the Italian fellow that I was working with goes, why don't you use the tractor? What? Why did you carry these up on your shoulder? Why didn't you use the tractor? I said, why didn't you tell me about that? He goes, well, I thought you knew that there was a tractor you could use. And I went, no, I didn't. I feel shorter and chubbier because my spine is now compressed, and it's an awful lot like that. There is hope, which is the tractor, but people don't say to you, hey, why don't you use the tractor? Why don't you go see a doctor? Because somehow we're supposed to figure stuff out on our own. And one of the hardest things, and I can't harp on this enough, and I will until you go, time's up, and then cut off my microphone. But the asking for help isn't weak. It's the most courageous thing you can do. It really is, especially if you've been brought up to think that you have to help yourself and only yourself, and have to be there. And when you ask for help, it just feels like a weight has come off your shoulder, and people will help you carry your baggage.
Absolutely.
You just need to ask. And you know what other people will do? They'll help you go through that baggage and go, hey, you don't need to carry this anymore. And that's why I love flying. When I'm on Delta and they say, hey, do you have any baggage? I go, you have no idea how much baggage. You have no idea. Some of this is my mother's and I'm still carrying it. Right? But we live in a it can't be me society, right?
Yeah.
This doesn't happen to me. And it does. We all.
It feels like a character flaw, right? I mean, and that's what we have to.
It's a flaw in your character. It's a flaw in your chemicals.
Yeah.
That's a great line. And I think one other thing we kind of want to prompt you guys to speak about is both of you guys, because you work in the area, you have a lot of resources, or you know a lot about resources. And so as part of the webinar, we've been collecting resources, and we're going to share all the resources that we've collected with everybody who's watching. So I don't know if you guys want to talk about resources that are available or stuff that you guys are doing, individually with your associations to really, promote this, but certainly want to give you guys a platform if we can.
Absolutely.
I stand on a soapbox and I talk about mental health until people tell me to be quiet, because it's my job. The other day we were on the radio and they said, Tazzy, what's your hope for your job? I said, it's to talk myself out of a job. And there's lots of resources. There's online resources, Canadian Mental Health Association in Toronto. There's the Mood Disorders Association, and there's the Suicide Prevention, Suicide Helpline. There's, I'm sure that your union has, with your bargaining, you have the, an EAP and things, but it's going to take time and it's going to be hard, right? Concrete doesn't set in 20 minutes, right? You set and you go and you do and you smooth and you do, and it's a process, and it's going to be hard. So the sooner you ask for help, the sooner you're going to be able to get in to see somebody. And that's the rub in this country and the United States as well. Right now I'm in Manitoba, but it's between 10 and 13 months before a child can see a counselor, and longer for adults. You know what? The most important thing you can do, sorry, I'm going to be talking over you, Bryan, here for a second. The most important thing you can do is ask for help. The second most important thing you can do is listen. When somebody reaches out to you and asks you to listen, they're not asking you to give a diagnosis. They're not asking you for a cure. They're not asking you to do anything more than, please, let me bear myself with you a little bit. Let's have some tears together. And let's just tell me it's going to be okay. Because the great saying is that it'll all be okay in the end. If it is not yet okay, it is not yet the end. But all we need to do is listen. And a lot of people have forgotten how to listen. They wait for their turn to talk. And we just want you to listen and be okay with saying, I don't know how to handle this, but I will listen. I'm here for you.
Yeah, and it can feel like when you're going through it, like you're banging your head against the wall. Because I had people reach out and say, oh, let me know how I can help. Like, I felt I was a broken record repeating it to friends and family, and it never helped, but it did help. I mean, you just don't realize in the moment that, it's baby steps sometimes when you're that far down, but you got to make the effort to do it, and there will be progress. But, I just wanted to kind of get back to in terms of resources. I mean, since the pandemic, the counselors and psychologists that we've had have been speaking about this echo pandemic, that mental health is going to become a huge crisis post-pandemic. We're still in a pandemic. So, I mean, and you can see the effects already that are pretty intense. So, I think, disability costs, obviously, presenteeism, absenteeism, that all affects employers, but there's a lot of great resources out there. There's something called Mental Health First Aid, which we've had some trainings on, and I think is a great program. We have that mental health virtual conference every year, I mentioned in August and September. Then there's our Canadian annual conference, which actually starts this Sunday and features Big Daddy Tazz. He's our keynote on Wednesday, November 30th. And we do have other mental health topics at the conference. And then I mentioned earlier our Health and Wellness Innovations Conference, which is in February. And that one, this year we are opening with a pre-conference on suicide prevention. It's a safe talk. It's been around, I believe, since 1981. And it really just shows you how to recognize when someone is suicidal and how to speak to them in the right way and the most supportive way you can. Obviously a sensitive topic. So, and then following that, our whole first day of the conference is on mental health and resilience, and how employers can do more, because when there isn't enough counselors, we all need to step in and do more, and really governments need to do more to make sure there are more people to help, because right now it is a crisis, and with the pandemic it's likely to get worse. So, other things we're doing is we have webcasts, and we do have a website. I'll share that with Andrew so he can share it with you with some mental health resources. We have some research that we've done with employers, so you can see what other employers have done. But I appreciate being able to share that with you. And, Big Daddy Tazz, I met him in Savannah just prior to the pandemic. It was literally like 2 weeks before everything shut down. And yeah, just blew everyone away. He got in super late the night before his presentation, I think like 3 hours before his presentation. And he didn't miss a beat. I mean, like, just blew away everyone. And it was phenomenal. And I'm so happy to have him here with me today, and so happy that he's going to be at our conference on Wednesday.
Yeah, and we'll collect all these resources. We'll put them out. I don't know if I can bug you guys and put you on the spot, but I'd love to give you the opportunity to kind of just leave us with a final thought, right? Because I think sometimes that's a very effective way just to end a conversation. So, I'll turn it back to you guys for a final thought.
Don't be afraid to ask. Talk to your friends, because statistically you're going to spend more time with your coworkers than your families are going to spend with you and their families. And you have to normalize the conversation, normalize saying I love you, say nice things about the people that are around you, because don't save it for the eulogy, because that's what we do at funerals. We'll say such nice things. Stop doing that. Say it now so they know that they're valued people. And you know what? I'm so passionate about this. And I need you to understand that you need to be kind to others, but we forget to be kind to ourselves. That's what we forget to do. We have no problem standing up for ourselves, but we will not stand up to ourselves. And so we lie to ourselves every once in a while and say, I really don't need help. This will be fine. I'm a burden, but don't. And when you see somebody struggling, ask. Make it weird if you have to. If they use a 4-letter F word, which is fine, ask again. Fine is a word that you say when you're not sure if the person that's listening to you can be trusted with your secrets, right? And fine is a word, unfortunately, that many people want to hear so they don't have to get involved in other people's lives. But when you talk to people and you know they're hurting, move forward. It might wreck their friendship. It might wreck things for you for a while. But I'm here to tell you, and I wish I didn't know this, it's way better to lose a friendship than a friend. And I wish I didn't know that. I wish she was still here to yell at me and scream at me for getting involved. And you're valuable. You're way more loved than anybody will ever tell you. You have no idea how incredibly important you are to people. Even just by being you or smiling or saying a kind word, you can change somebody's life. So do that for yourself.
Yeah, that's a great message. Great message. Hard to follow up. I'll just use the word support because it means so many things. Support others who need it by listening, like Big Daddy Tazz said, and by being there for them, and support yourself and realize that there are so many supportive people out there. Like I mentioned, I could not believe the amount of support I received when I published that blog. People were so gracious and complimentary, and I think there's just people are generally going to support you when they realize you're suffering. Nobody wants to see someone going through that.
You know what? If you close your eyes right now and just think of the most loved person in the world and how you would feel if you lost them, realize that other people feel that way about you as well. And it's okay to say, I don't know and I don't understand what you're going through, but I'm here for you. And that's it. That's all we want. We just want to know that we're not alone and that there is hope. Without hope, we become hopeless. Without hopeless, we become dark. And in the darkness, we feel like we don't exist, shouldn't exist anymore. And so what we need to do is bring the light to other people's lives. And we all have that within ourselves to do that. That's all we want. And just to get men especially, and no offense to any women that might be listening, but men seem to have a harder time to come forward and say, I need help. And we're here to help. Everybody right now, the 4 of us here and everybody that's around you love you and value you. If we didn't, we wouldn't be uncomfortable right now. I got the greatest email the other day that said, Tazzy, thank you for getting emotionally naked on stage and uncomfortable, because it makes me feel okay being uncomfortable. It makes me feel better in my own skin. And so the more we talk about it, and then it becomes normal, and we don't have to worry about it because people will get help the same they would if they got the flu or things like that. And I really appreciate you letting me be part of this conversation. It's so important to me.
Thank you.
Yeah,
so much.
we just wanted to say thank you, Big Daddy Tazz and Bryan. I'll let you jump back in, but we've had other people kind of come and share their story, and it's always kind of the highest rated part of the webinar. I think, as you guys have said, people just want genuine connections, and listening to you guys speak, we all know there's a lot of people that are feeling everything that you're saying. Certainly that rock metaphor, I think that's really powerful, right? Like in construction, you need a solid foundation, concrete this, rocks that, and you're right. Like sometimes the rock drowns, right? And so that was great. And Bryan, I mean, when I first read your blog, I thought, you know, I wasn't even going down that mindset, but as I'm reading it, I'm like, there is so much good that can come from this blog and hearing your story. Because, you know, in Canada, we do Bell Let's Talk. And I think they say it's, I mean, a jump in a card, is it 1 in 4, 1 in 2? The more you think about it, it's 1 in 1. There isn't anybody in construction that hasn't had, you know, direct exposure personally or a close friend to mental health, right? And so if Bell, you know, wants to be honest, change the ratio. It's 1 to 1, and you guys sharing your story today is going to help a lot of those people experiencing it. So I just can't say thank you enough.
I just appreciate the opportunity to chat, and I really enjoyed it. And yeah, thanks to everyone here involved.
I'm glad you love your employees and your kin as much as you do to put this together so that they know that when they're struggling, they don't have to do it alone anymore. And you're right. They say twice as many women suffer from a mental health issue than men. It's not that. It's because twice as many females feel more comfortable talking than men do. And let's stop that, right? Let's just make it okay.
Yeah. Okay, with that, I'm going to end the recording. Okay. So I think we went a little bit over, but I certainly wanted to turn it back to Amina to maybe do an abbreviated closing.
Yeah, so I already did my, again, in the apologies for the technical difficulties, but I did my closing remarks before, so I won't say them again and repeat myself, but I just wanted to thank all the speakers today for being with us, and we will make sure to have the resources and the presentations from today sent to anyone who RSVP'd along with the webinar recording in the next couple of days. And as always, we will let members know about our events coming up. However, this is our last webinar for 2022. So thanks to everyone who has consistently attended these webinars and RESCON events. And we're looking forward to seeing you again in 2023.